In this lecture, I'm going to discuss stress management. Much like the cognitive theories of motivation that we've studied, we take the perspective that each of us appraises our surroundings and thinks about those surroundings and our responses to those surroundings. And we view the cognitive appraisal of our environment as related to stress as a two-part process. In the first part of that two-part process, we categorize the stressor. We view our surroundings and we think about whether or not it's a positive event for us, whether it's perhaps a negative event for us, or even if it's meaningful, regardless of whether it's positive or negative, we then assess whether or not it's even meaningful to us. The second step is where we think about the potential responses because we want to reduce stress. Much like biologically, we want to maintain homeostasis, in other words, a balance in our biological systems. We also want to maintain a balance in our psychological systems. Of course, individual differences influence these processes. We know that emotional stability is strongly related to stress. The less stable the individual, the more that individual can have negative reactions to stress, and the more stable, then the less the negative reactions to stress. We know that type A behavior pattern is also sometimes problematic. That type A behavior individuals are often impatient, often hostile, and that's been related to coronary heart disease. Of course, we know that the policing profession tends to attract type A behavior patterns. Social support also influences how each of us may react to stress. Some of us have support structures in our families and friends that provide us emotional support. Some of us have also support systems that enable us to appraise our surroundings and to more accurately assess those surroundings. And finally, informational support may vary from individual to individual in terms of what information they may be able to access. But in general, each of us, as we know, is different, and we all know individuals who are more capable of coping with stress than others. And coping is what we're going to discuss now. There are two types of coping. The first is problem-focused. We want to take actions to deal directly with the source of the threat. The other type of coping action is emotion-focused, where we try to alleviate stressful feelings and emotions. Now, there are outcomes from these coping mechanisms that we may engage in, and they may be positive or they may be negative. Behavioral outcomes are one of the things that occur as a matter of coping. We can just view the simple fight or flight reaction of humans when they perceive harmful or deadly threats. That the behavior is either to flee or to fight. And depending on the circumstances, that behavior could be positive or it could be negative, depending again on the circumstances. Cognitive, we view our world and we think about it, and we make decisions about it. And of course, our cognitive processes may be accurate, and to the extent that they're accurate, they're more likely to produce positive outcomes. And to the extent that they're inaccurate, they're more likely to create negative outcomes. Physiological outcomes occur when we perceive stress or when we perceive in particular danger. We know that's why that often our mouth becomes dry, our heart rate increases, and things of that nature. It's our body's reaction to a stressful situation and shunting blood and other resources to those areas of the body that the body senses to be the most critical in terms of meeting the stressful event. One thing to consider about stress is what we call the underload overload continuum. Low performance can occur if we're underloaded. In other words, if we're not stressed sufficiently. It can also occur if we're overloaded, if we have too much stress. And obviously, optimal performance is somewhere in between. We want a sufficient load or stress to create growth or improvement or adaptation, but we also don't want so much stress that we cannot grow, strengthen, or adapt. Now, when we think about our related theories, equity theory, if we perceive an inequity, that's going to be a stressful event or circumstance, and we will view that as positive or negative. We typically, most people view it as negative, and a coping mechanism would be one of the strategies we use to react to the stress of the perceived inequity, leaving the field or reducing inputs or something of that nature. Expectancy theory, again related to stress, in that if we have low expectancy, if we don't believe we can do it, then obviously, at least perceptually, we're overloaded. Also, if we don't believe we're going to receive the reward, that's very similar to equity. And then obviously reward outcome doesn't meet our expectations. Then that too is a stressor. Goal setting is really all about stress, the overload underload continuum. You want sufficient overload, or you want sufficient load to motivate, but you don't want too much of a load and demotivate. Motivation through consequences is related to stress, in that the consequences of our behaviors create circumstances that may be stressful, that may result in either reward or punishment. And again, that may be viewed as positive or negative. And then job redesign, again, as another function of our surroundings, and we may view that as positive or negative, or meaningful or not meaningful. But again, a high growth need strength person in a low growth need job is going to be stressed, and likewise a high growth need strength person in a low growth need job is going to be stressed. We need to think about the person-environment fit. Now, we've talked about realistic job profiles. It's important that people understand clearly what their circumstances will be like in a new job. We need to ensure that we select, that we have valid and reliable standards and processes, and that help us choose people who are more resilient and fit better with the stressors they're going to encounter. Personality is one of the factors we can't consider. Again, it needs to be matched to environment. We want people who are open to new experiences. People who want to achieve things, and so we just want to match that personality to the circumstances. We want it, of course, to be job related. And we want appropriate socialization processes. And in area 2, in group processes, we will talk about socialization. There are organizational programs that most organizations have or can implement that help individuals manage stress. Most organizations have an employee assistance program where at least short-term counseling may be available for individuals who encounter stressful events, either professionally or personally in their lives. Wellness programs typically incorporate many of the EAP functions in terms of emotional support, but also focus on wellness in terms of health, physical fitness, which we know is related to our ability to endure or counter stress. There are individual programs, cognitive in terms of training individuals to understand stress, to understand the symptoms of stress, and understand what the coping mechanisms are, and recognize which ones are positive or negative, is a form of training or education that we can implement to reduce stress. It may sound kind of kumbaya, but relaxation training, meditation, and biofeedback are all forms of relaxation or forms of coping which reduce some of the negative impacts of stress. Finally, there are outcomes to stress. At the individual level, there is a strong negative correlation with organizational commitment. The greater the stressors involved in a particular organization, then the less committed people are going to be. The less the stressors, or the fewer stressors, then the greater organizational commitment will be. There's a moderate negative correlation with job performance. As stress rises, job performance tends to decrease, or as stress drops, it tends to improve. Again, it's only a moderate correlation because we know the underload overload continuum has effect on individual performance. There are organizational outcomes. There's lower performance, which obviously individuals who aren't performing optimally in the organization reduce the organization's performance. There are inefficiencies in terms of other people having to basically take up the slack for those who are performing low as a result of stress adaptation. There are HR results. There are health costs. We know stress is related to ill health, greater health costs for the organization, both in terms of personal health, health insurance costs, and on-the-job injuries. We know that turnover is affected, that the greater the stress, that organizational commitment drops, and the tendency of people to leave the organization increases. And finally, the recruiting and selection costs associated with continued turnover also reduce the organization's effectiveness.